Thank you much. And in this evening, we have panel 4, and the panel 4 is emerging trends of aging in China. And in panel 4, we have 3 speakers. The first speaker came from Center for Economic Research from Peking University. Her name is Zhao Yaohui. And the second speaker is Li Bingqin. She's a Sharp professor and the director of Chinese Social Policy Program, University of New South Wales from Australia. And the third professor is Wen Qiushi. He's associate professor from Department of Sociology. He also is the deputy director of Center for Family and Population Research of National University of Singapore. And all of them, I think they are very excellent research. They all made much more very outstanding contribution in their research fields. And I'm very happy to be the host of this session. And I'd like to learn more from their research results. And I think I should start our session. And the first speaker is Zhao Yaohui, Professor Zhao Yaohui. Her topic is healthy aging in China. I think it's a very excellent topic, and we really like to enjoy what you want to say. So please start your lecture, dear Professor Zhao Yaohui.
Thank you, Professor Zhang. I changed the topic slightly and narrowed it down to functional status of Chinese older adults. Next, please. So healthy aging is not just about health. According to WHO, it is the process of developing and maintaining the functional ability that enables well-being in older age. So functional status is very key in healthy aging. It's not just health, and it's very important in determining the burden of care as well. So my talk today will focus on the functional status. More specifically, I'm going to use China Health and Retirement Longitudinal Study to describe the functional status of older people and the trend that we are observing. Next, please. So I just mentioned the China Health and Retirement Longitudinal Study, the CHARLES project. The CHARLES project started in the first pilot survey was in 2008. We received one of the first seed funds from the World Bank under Bert Hoffman. So I'd like to acknowledge his contribution to our project. So Charles, after the pilot survey, we did the first round or the national baseline survey in 2011, and it has been followed up in 2013, 15, 18. 2020, and next year we're doing another survey. So in every wave, we asked about the functional status of our respondents. The question goes as follows. Because of health and memory problems, do you have any difficulties with certain things? And the things are, first category is activities of daily living, which includes eating, dressing, bathing, toileting, getting into and out of bed, controlling your urine and defecation. So these are ADL questions. And IADL questions include cooking, shopping, household chores, taking medicine, managing money, and making phone calls. So for each of these items, we have 4 choices. The first is no, I don't have any difficulty, and second is I have difficulty but can still do it. And the third and fourth options are what we define disability with. Yes, I have difficulty and need help. And fourth is I cannot do it. So based on these definitions, we define disability needing help. So these are what the families, either family provide care or the social institutions or whatever. Next, please. So we have 6 plus 5, a total of 11 items. Disability actually does not have a uniform definition. And the more items we include, the higher disability rate we get. If we use only ADL, any item of ADL items, in 2020, this is people over 60. 8.1% would be defined as having functional disability. And if we add cooking to it, it will go up to 11.8. And then adding more items results in higher rates of disability. Next, please. Next, please. So here I show 2 sets of numbers. The top 2 are according to the IADL or ADL or IADL, the most number of items, and the bottom 2 are the ADL, only the 6 ADL items. So for any definition, we would see rural people having higher disability rate, and women have higher rates than men. Next, please. So we grouped the items into 4 definitions. The lowest bar is only ADL difficulties, and the orange bars are ADL plus cooking and shopping, and the red and the green ones includes taking medicine, and the red ones are the most inclusive, including everything, including managing money and housework. So if we look at any specific definition, we actually see a declining trend over time. In just 10 years, we're seeing declines. For any definition, you will see decline, and the largest decline happens between 2018 and 2020. Next, please. So here we divide the sample into urban, rural. The right panel is urban, and the left is rural. We see for both urban rural areas there is a decline, but in the most recent 2 years, the declines in rural areas is much bigger. Next, please. So we want to understand why. Then we put each item on the graph and show the trend over time for each of these items. We see some interesting patterns. For example, toileting and controlling urine and defecation, we see much sharper decline in over time than other items. And then the bottom, for managing money and doing house chores, we also see much larger declines. Next, please. So this indicate that something happened in recent years that are causing people to have fewer functional disabilities. And we know in the most recent years, China has done a lot of things in terms of home improvement, home living environment improvement. For example, toilet. Uh, uh, there has been a rural toilet revolution, like converting the traditional toilet into a more modern type, flushing toilet with seats that enable older people to manage their toileting on their own. And also for cooking and housework items in rural areas, tap water installation policies and also cooking fuel shifts from coal or biomass to natural gas or electricity. These enable people to, these simplify housework. The difficulty reduces the difficulty, so may also enable people to manage. Shopping, we know internet availability has improved greatly over years, especially since 2018, when mobile shopping and is much easier with the smartphones. And so especially in rural areas, most recent public health changes in especially in poor rural areas, probably contributed to the reduction in disability. Next, please. So those are our conjectures, but of course, more rigorous studies are needed to establish the causal paths. But still, we think it's very significant to have this finding that there is a compression of morbidity happening in China. In many other developed countries, there have been a documentation of this compression morbidity, along with more increased life years. But this is the first time we are seeing this happening in China. And this is also possibly evidence that functional disabilities can be changed, can be modified by public policy measures. In many developed countries, you don't see such rapid changes in policy, in people's living environment. But we are seeing that in China, and this is possibly evidence that this is actually changing the functional limitations. Next, please. So we use these rates of disabilities to infer national statistics on the number of people who need care. And we use 4 definitions as rates, and then we have national statistics on number of people in specific age groups. So then we're able to get, since Charles is a nationally representative survey, and then we use weights to make it more like the national population. So I'm not going to have much time discussing how we weigh the sample, but at the end, we're able to infer to the national statistics. So we're reporting from 2011 to 2020 the number of people across China who need help. If you look at 2020, in using the most narrow definition, which is only ADL difficulties, you have like 20 million. Yes, 20 million people. This is over age 60. But if we use the most expensive definition, which is ADL plus IADL, any item, the number is 45 million. And we're actually seeing a decline in the absolute number of people who require care. Next, please. This graph shows statistics for people over age 50. In the previous graph that I showed the age patterns of disability, we saw that disability does not start at age 60. Although many surveys, including Chinese National Survey of Aging Population or the Chinese census, they start to ask about disability questions from age 60. Actually, between age 50 and 60, there were disabled people. So this definition is from age 50. We see more people in this category. Next, please. So how many people are in this category? So this graph shows number of people age 50 to 59, disabled people in this category divided by total disabled people over age 60. We see this is actually quite significant number of people in this category. They are 20% to 30%. They will increase the number of disabled people by 20 to 30%. So they are not a negligible group of disabled people. Next, please. And then the last thing we did is we asked the changes in the absolute number of people in disability, the contributions from the population base versus the contribution of the disability rates. This figure shows our decomposition using only ADL questions and age 60 and older. 60 and older in the right panel, 50 and older in the left panel. So we and then the base is 2011. So 2013, 15, 18, and 2020 are all relative to 2011. So the empty, the not colored bars are the absolute numbers of people in disability changes compared to 2011. So we see a decline in 2020. We see increases up to 2018 and then the decline in 2020. And then the decline was due to a decline in the rates of disability. In previous years, rates declines are not able to offset the increase due to more population in this age group. But in 2020, it's able to offset. So the net change becomes negative, and it's all due to a decline in the rates. In previous years, the rates have also been declining, but they're relatively small, so that the number of people in disability is increasing, but it's changed in 2020. Next, please. I don't know how much time I have now. This is okay. So then this graph shows a wider definition. ADL includes cooking and shopping. We see the same pattern, essentially the same pattern. It's been going, the decline in rates was able to offset the entire increase due to population change. Next, please. Yeah, so we did for the other two more expensive definition, and it's the same story. Can we next, please? So our conclusions are first, the race and numbers of functional disability are sensitive to items included in the definition. So there ought to be research to study what's the most appropriate scope of definitions. We looked at the items included in the Chinese neighborhood care facilities. We think a conservative definition, a more appropriate definition, a conservative definition should include all ADL items plus cooking and shopping, because without cooking, the person would the life cannot be sustained, and you need to buy food in order to eat. So we thought we should include cooking and shopping. If we use this scope, that is the second scope on top of ADL, then we would have a rate of 13.5% and 34.2 million people. I think this is 2020. I'm not so sure. I think it's 2020. We could go back to look at the numbers. But regardless of definitions, the rates of disability have been declining in China, and our study is the first that's able to document this. And we show that the decline in the rates of disability have more than offset rising older population size and contributed to a decline in the total number of disabled people in China in the most recent 2 years. Thank you very much.
Okay, thank you, Professor Zhao. And I think it's a very important research because of disabled pupils' life and their development should include in all of the society's development. And in recent years, we are glad to see the trends getting better because of the disability rate is getting lower and lower in recent years. So social development and economic development is getting better for their home and the family members. So maybe this kind of number will getting lower. But within the population, aging population getting more and more, maybe disability rate is lower, but the number of the disabled people will getting large because of the aging people. Most of them have some kinds of this disease or this kind of trouble. So I think it's a very, very important research fields. We should make much more progress on this kind of the research. So it's very, very good research. And the second speaker is Bingqin Li. Her topic is aging society and the community-based services in China. I still think it's a very, very important research topic. So we are eager to enjoy what your research findings. So please, Bingqin Li, please, Professor Bingqin. Can you hear me?
Yeah, sorry. Can you hear me now? Hello? Yeah. So thanks, Professor Zhang, for giving me the nice introduction. So this in this talk, I will discuss the situation of community-based services, which is gaining significance in China and probably will be more so after the COVID-19, as old age care homes perceived to be a higher risk by many older people. Of course, that is just a possibility. Next page. The policy context for community-based care is that there are three main types of old age care in China. Shanghai City developed a target since 2007 to produce institutionalized care offered either by the state or the market, provided for 3% of the older population, and the community-based care for 7%, and 90% of the older people will stay at home. This policy was copied by many other cities, some with slight variation of the proportions. But it is not a national policy. But because it is very popular, so it's set a paradigm change in China. After some years of local practices, people started to question the meaning of community-based care. It is increasingly recognized that community-based care and home-based care should be merged, with the communities providing platform for resource allocation and arrange supporting services to older people who want to stay at home. So with this change, people think that maybe the community and home-based care should be perceived as one. Next page, please. So what do we know about the community-based care in China now? Next. The chart of this 2 years, basically the red shows 2000 and the blue shows 2015. And so there's a growing need of care. Professor Zhao's presentation also mentioned that, not only by the number of people, but also by the proportion of the people. There are several kind of possible explanations for this. One is the challenges in the ability of informal care as a result of one-child policy, migration, and the changing cultural norms. We have done a research showing that older people these days try very hard to lure the kids to stay closer to them. And they would be very proud that if their migrant children can keep a room for the older parents, even if they do not go there. And there can be also changes in awareness of the need of care. It is culturally more acceptable for older people to seek external care or support. Sometimes there are even peer pressure among either the older people or among adult children to go to good quality care homes. And also marketing of old age care, real estates and services also target older people more aggressively than before. The next page, please. If we focus on communities only, let's see what types of community care that older people said they need. And this is data I kind of got from the Center of Research of Aging. So there might be something wrong with the data. Because the way I think because the total add together is not right, but what we want to see is what type of care people are talking about. So what we can see that there are healthcare and help with family chores and health recovery nursing, counseling or chatting. So a lot of older people feel psychologically lonely, and also they need knowledge support for their health issues. And also some of them need daycare and the food services, help with bath or shower, the rental services of disability or assistive equipment. So these are the kind of request older people want to have. And here, that is, we can see what are the services that are available. So I try to put on the request in the other one in these slides, in this projected on these slides. So the number on the right-hand side is what percentages of communities that actually have this kind of services. So what we can see is that some of the services the older people do not necessarily ask, and they are there. And but some they really need are also there, but the coverage is quite low on the whole. All sorts of coverage, apart from the health knowledge assistance, most of them are very low in the communities. And what is also need to pay attention to is that this distribution is nationwide. Some of the best places I've been to, like Zhejiang provinces or Shanghai, and you have the best kind of facilities and community support. But then some other provinces, you go there, you do not see anything. And also, even within one city, in some of the good examples you visit, everything is fine. You go next to things do not exist. So there's highly a lot of inequality, and the gaps still exist. Next, please. So let's try to look at the care facilities. And the purple and the green bars on the top are community-based organizations providing services. And they are growing, you can see that they're growing faster than the care homes. So that is the kind of following the policy instructions. So this is more or less expected. The next slides. So the government use this number of beds often as an indicator to monitor the local performances. So here we can see that the beds in care homes are more or less stabilized. And the community's beds has increased fast initially, but then also stabilized. And in recent years, particularly more recently, even in the news, that they are declining numbers. Some of them are shut down. And why is this the case? And also another set of why. I just raised the questions. So this chart shows that the number of people in care is declining as the number of beds are increasing. Why? And the answer, clearly there's a serious mismatch between supply and the demand. So on the demand, here are some explanations. And on the demand side, of course, we have discussed that there's a awareness for the need of support is growing. But the services, the awareness of for the need is not growing as fast as number of beds, and also affordability is still an issue. And the others I have discussed. And also on the supply side, the quality of care is often considered one of the issues that people consider. Let's say if they go to the community daycare centers and they felt that you have the beds, but it's more or less for a sleep, for a nap. So whether it is actually useful is not very clear. So here are some issues we can highlight. One is the funding model of the community-based services. So far, a lot of the services are contracted services funded by government grants. And some of them are long-term grants, but a lot of the services can be kind of on and off. So maybe with the introduction of long-term care insurance, the older people would possibly have opportunities to make their own choice and where to put money. And that might see a possible improvement. But at this stage is not yet very clear. And also labor supply is a serious bottleneck in China, as the country is not only experiencing aging, but also suffering from the consequences of this one-child policy. So the gap in care labor force will be severe. And also will be even more severe soon. So there needs to be some creative solutions here. So far, there are some mutual support style old age care, And these mainly existed in rural areas. But in some of the western provinces which have a lot of migration out migrants, and we can see that in cities, they also started to develop this kind of a community-based mutual support care. So they use the volunteers system to help. And after COVID-19, it seems that there's a surge of volunteer activities in China. And probably some of these can potentially be directed to old age care in the future more. And also, there's a short of user-centered policy making and service provision. That is the reason related to the fact that you have, on the one hand, more supply of beds, but then on the other hand, the user. So if the communities can decide how they are going to use the money and then where to put, probably some of the waste can be reduced. And of course, another key important is the built environment. And the government recently has produced a lot of more, try to put as a focus to improve, to do the adaptation of old age friendly built environment. And hopefully some of these constraints for the built environment would be less severe, and also it would be able to help the older people to make more use of the community facilities. So what do we need to know in the future? And I put down, based on some of the issues we have discussed, and there need to be a better understanding of several questions for future policy considerations. The first one is, are community and home-based care more labor efficient than the private care homes? Given that labor supply is a serious constraint, so probably there needs to be some looking at the supply side, not only in terms of infrastructure, but also the labor supply. And also there needs to be a user-centered kind of attitude in terms of care supply planning. And then the willingness of labor supply is also an issue, not only the population, the age structure, because the low pay, heavy workload, and the stress, also lack of career paths and the stigmatization. And these kind of issues have appeared, come up during our interviews with some of the care homes. So younger people are not very keen to get into this sector. And also, what should be the priority in community-based care? And also, who decides these priorities? And also, who should pay? Another issue is the relationship between community-based care and healthcare. And if you look at the chart earlier, the table earlier, health is actually one of the very important issues. I know that there are some pilots trying to combine aged care and health care in the community, primary care. So hopefully, and this kind of combination can be done more broadly. And another perspective is the migrant older people. Quite often, if you go to some of the communities, a lot of the cares require the people who are residents in this, at least long-term residents. A lot of the migrant older people may not be qualified for that. And also the last question, of course, everybody have interest in is, what is the implication of COVID-19 in terms of determining the people's preference, a choice for old age care in the future? And next. So here are some references of some of the research we have been doing. And hopefully in the future we will be able to develop more research and in collaboration with our colleagues. Thank you.
for your very great introduction about aging society and community care and the community services in our society. Because of the aging speed up in China and because of the family planning policy. In family planning policy, shrunk the children population dramatically in past 4 decades. So aging population getting more and more, and the children population getting lower and lower. And in recent days, because of the migration even in the same city, the children population will move from their community and buy their house in another community. So the distance between children family to their parents' family getting longer. So community care is much more welcomed by aging people. So I think this kind of the service is very important to aging people's common life. So your research give us much more very good materials to understand aging people's needs and to the social policy makers. They will from your research maybe they will abstract much more material and your suggestions to the decision process. So thank you very much. Thank you, Professor Zhao and Li Bingqin. Let's start the third professor. And Professor Feng Qiushi's topic is rural vitalization, population aging, and the toilet revolution in China. Maybe your research with Mr. Zhou's research, we have some linkage to understand more about these two researchers. So let's start to enjoy your research findings. Please start your lecture here, Professor Feng Qiushi.
Thank you, Professor Zhang. You are very right. I would like to continue the discussion started by Professor Zhao and then also Professor Li. It's truly my great pleasure to join this prestigious forum. And today, my presentation will be about 3 very important policy issues. And I would like to introduce some perspective to integrate these perspectives in order to shed light to this field. Next, please. Okay. First of all, I would like to say policy making itself is a procedure of computation of compromise by different subsystems of our society. It is quite clear that in this COVID-19, concern of public health and medicine is competing with the concern of economic growth and employment. So clearly, public policy is a discourse involving a lot of agencies and ideas. Particularly in regard to population aging, I would like to say it could be very complicated because on the one side, population aging is a kind of foundational parameter of the entire social and economic system. And more than that, aging itself is related to many disciplines. That's why the knowledge legitimacy actually can come from a very multidisciplinary way. And that's why in the domain, in the public policy arena, there's a great variety of aging policies. For example, focusing on the young labor supply, as our previous session has been discussed about, worry about affordability of the pension system and the accessibility of the healthcare resources. Especially for sociologists, we all care about the sustainability of our family support system. These are all major policy concerns. Next, please. Based on this complicated public policy scheme, and Professor Ronan Kong has been strongly advocate for a scenario That is, we need to promote the model of the social transformation in the macro level. And to do that, we have to realize the old legacy are already there in place. We need to re-engineer the whole societal institution to be in match with the new demand of the population aging. However, in practice, it is very hard to change the established legacy of institutions because it's involved with established ideas, justification, and interest. And this is also true for China, uh, who is holding the largest older population in the foreseeable future. Next, please. Actually, for China, just last year, a very major decision has been made by the top policy agency. And this year, in October, it has been formalized in the Chinese fifth five-year plan. For the very first time, aging issue become the national top-level strategy. By saying that, we are saying China have a lot of national strategies, but in regard to top-level national strategies, this is really the first time aging policy, especially active response to population aging, has been listed as the top concern. However, the key word of being active in the response, how do you define active? So far, there's only one law about elderly people in China, and there's very rare administrative regulations in regard to the well-being and health of older adults. There's a long way to go for us to see how we could be active in response to population aging. Next, please. In this regard, this is just the research we are just starting to do. We would like to propose that because population aging is a fundamental parameter, and that's why we need to introduce this perspective to all the established policy schemes to increase their feasibility and effectiveness. And we also propose that to actively respond to population aging, we need to reconfigure the current social policy. By saying reconfiguration, we are not trying to say we need to change or replace, but we think it's more feasible for us to penetrate or permeate the aging perspective in the established national strategies. Here, I would like to use about 2 examples to show how can we do this and to show the potentials of being active. Next, please. The first example is definitely, as I mentioned, is the rural vitalization. And these are the very general ideas of the information about Chinese rural development. Chinese rural reform actually is the very indicate the very beginning of Chinese grand reform. And the new rural vitalization plan proposed very recently aim to build up a very strong agriculture economic sector and build up ecologically friendly, beautiful countryside, and then the well-off rural populations. It has a lot of economical and social indicators to support this general ambitious national plan. Next, please. And then in history, China is actually doing quite greatly in promoting the rural development, although the rural-urban division is still quite significant. Next, please. But in face of this, general national plan of rural vitalization, we want to introduce the population aging issues to ask the vitalization of whom, by whom, and for whom. Because the Chinese rural development is quite different from the other East Asian societies, such as Japan and Korea, which concentrate on protecting the small-scale farmers. But the Chinese rural vitalization is promoting urbanization, promoting large-scale rural-urban migrations, and then recently encouraged land transfer. Under this kind of model, how could we have a successful village vitalization? From our point of view, we will have to introduce the population aging issues. Next, please. By saying that, I would like to propose that you can see clearly here the Chinese population, the rural population, has been declining gradually, and then the urbanization rate of China has reached the point of 50% in 2010. Next, please. And then we also see the Chinese population aging is quite severe. Next, please. By saying that, we want to propose that if we want rural vitalization in the near future, what face Chinese government will be a much smaller rural population. According to quite valid projections, by the year of 2050, the carrier and then the host of rural vitalization, which are the rural residents, will be only about 200 million, much less than the urban population. And this is a quite reasonable estimate. Next, please. And also because of this, you can see clearly that not only rural population is reduced, but also the population is, most of them are very old. About 60% of Chinese rural residents will be aged 65 years older. And then about half of them aged over 80 years. In a period, you may realize that will be the age range, according to Professor Zhao Yaohui, that will be the age range for various kinds of ADL disability. And according to Professor Li Bingqin, this will be the age which have a lot of increasing need for care. Next, please. And also, the rural household will have a very smaller size. And this is a research led by Professor Jin Yang, and she also highlight this general household structure change. As we can see in the rural area, the 3-generation household will be reducing from about 20% to only about 3%. And then the solo living elderly people will increase from about 12 to about 24%. And this is the population scenarios which has to be faced by the rural vitalization plan. And next, please. And this is also, we project, how these elderly people will live with. As you can see, most of them will be widowed with or without their children. That will be a living arrangement. There will be a very high care demands from these rural residents. And that's why we highlight the needs to think about who will be the carrier, the hosts, and then the beneficiary of rural vitalization. Really, in order to do that, we will have to encourage a new type of rural economy to attract young people coming back to the rural area, to promote the other care sectors in the rural areas to meet the increasing demands for those elderly adults. Next, please. A very related issue, as Professor Zhao also mentioned, is the toilet revolution. This is a very interesting phenomenon because toilet revolution as a public policy has very greatly diversified discourse in its construction. At the very beginning, toilet revolution was proposed by the UNICEF in order to protect children because the environment pollution and the insanitation make up one of the major cause for the children to die before being mature. And later this has been picked up as an environmental and also a public health issue because sanitary toilets is a very important measure to be against infectious diseases and against environmental pollution. This proposal has been so welcomed by the developing societies as one of the major issues in the developmental agenda. In Japan, it has been used as a measure to promote tourism. In India, it has been constructed as a movement to help protect the females. And next, please. In China, the construction is even more fancier. At the very beginning, in the 1930s, before the new China was established, having the flushing toilet has been considered as a national dream for the famous scholar as Zhou Gucheng in Fudan University. After the new China was established, having cleaned the toilet has been considered as a symbol of patriotism. And later in 1990s, because Beijing is hold the Asian Olympic Games, it is also linked to the national pride to show the clean the toilet to the foreigners. But later, this discourse has been changed. Very recently, toilet revolution has been linked to promote tourism, as suggested by President Xi Jinping. And more recently, it has been linked to the rural vitalization. Next, please. For our point of view, we think China has already made huge progress in improved indoor toileting facilities. However, it's far from enough. As you can see from the county map, there's still a big proportion of Chinese people do not have cleaned indoor toileting facility. Next, please. Including the at least basic sanitary surface, China made good progress in the past 20 years, but still about 16% of the Chinese do not have the basic sanitation service at home. Next, please. What we find, as already highlighted by Professor Zhao, we can see toilet revolution is highly related to aging because one of the major markers of disability is toileting. Another one is bathing. As you can see from our early research, bathing and toileting became two of the major types of disability. But more interestingly, bathing and toileting are the major two types of disability highly embedded in the environment because you need a bathroom, you need a restroom. In that regard, there's a huge room for us to do intervention, namely to reduce disability, not to reduce the intrinsic body limitation, but to improve people's ability, even though they have functional limitations. We can change their disability by simply alleviate the difficulties created by the environmental barriers. Next, please. In this regard, we want to test whether we could introduce the aging perspective in the toilet revolution. We did some empirical studies, try to see whether the simple environmental change could effectively reduce the disability of toileting and bathing. I think this is the very first study, examining how Chinese elderly people do toileting and bathing. For the urban area, most of the facilities has been modernized, but in the Chinese rural area, there's a lot of pre-modern solutions for bathing and toileting. Next, please. What we find is only 40% of the Chinese people in the rural area have showering indoor at home, or they could bathing indoor at home. But about 15% of them still go bathing in the public facilities. And in terms of toileting, the squatting indoors is still the traditional way of doing toileting. And then only about 24% of them have this modern pedestal pan indoors. Needless to say, this is a very important point because many older people even die of toileting while they have cardiovascular diseases. And not only the facilities, but the literacy of toileting is pretty much underdeveloped in China. Next, please. We run different kind of regression models. We found very strong significant effect of change of the facilities of bathing and toileting. They will immediately and significantly change people's self-report of ADL disability. Next, please. We think we need to introduce and penetrate this aging idea into the toileting revolution. In this regard, we need to put the toilet revolution under this age-friendly village movement as called by the WHO for the global age-friendly cities, creating aging-friendly environment for the older people are supposed to be one of the major discourse for the public policy of toilet revolution. It is very unfortunate if we ignore this important part for the public policy of toilet revolution. Next, please. We have for a little bit discussion, I think we want to highlight our major point again. We hope to introduce the aging issues to all of the related public policies. In this presentation, we just use rural vitalization and toilet revolution as two examples and showing the huge potential for us to rethink, re-engineer, and reconfigure the current policy of China related to population aging. Next, please. We have a good team to do this, and we also welcome interested scholars to join us. And thank you very much.
Thank you very much about your introduction about your research, and let us understand more about the aging people's need and the social policy or public policy needed to support their common life. And especially in the rural area, their life is improved, but they need bus and need toilet, especially flushing toilet to improve their common life. It's okay. I think it's a very excellent research, and Mr. Feng give us many more impressions about the from the introduction. It's a very great research. So we have half hour to discussion about these speakers talking about that. And I found Mr. Bert Hoffman is still here. And maybe in the beginning we should say the questions. Bert Hoffman just give Professor Zhao congratulations about the survey of Charles. I think it's a very important survey. Most of the scholars use this kind of survey, so maybe the investors should invest this kind of the survey. It's okay. And one question from Professor Zhao Yaohui. I said that for declining difficulties in activities like shopping, is it that the tasks are being carried out remotely by their children using internet shopping rather than or in addition to the elderly doing them through internet? So it's a very good question. So the aging people can use internet or not can use internet to do some shopping work. So maybe Professor Zhao will give her answer to all of us. So Professor Zhao.
So the question, should I just answer the question that you read? Whether it's possible. I won't exclude that possibility. It is possible that when they answer the question, do you have difficulties buying stuff, shopping? They answer no difficulties when their children are helping. But it's not. I don't think it's the norm for answering the question, because we're asking, due to your health and memory reasons, are you able to do this and that? So I don't think that dominates it, even if there are cases of children shopping being answered as parents being able to shop. Does that answer that?
Yes, another question to dear Professor Zhao. Thank you for your presentation. It's very interesting. Would you
Really?
please share some insights about the gender differences regarding Chinese or the adults of functional status, if any?
Okay. We see in most dimensions of health that women fare worse than men. And ADL or IADL difficulties are just one of the functional disability. Many others, be it being depression or cognition or measured health, we see that women have much worse health than men. This is true not just China but many other places as well. You may think you may find it surprising because women live longer than men, but the two facts coexist. They are not conflicting. This implies that women live under worse health conditions longer.
Yes, and another question for, it is a new question for dear Professor Li. I wonder whether there is any regulation related to build and environment for elderly care in China. So, Bingqin Li, Professor, would you like to answer this question?
So regulations in terms of elderly care. So do you? I think probably this person is from Professor Chen, and so he's talking about the elderly care regulation of the care facilities. I think so. I think so. So if it's for the built environment of the care facilities, of course, there are a requirement on this. And if you build, let's say, it should be easier for people to use, and also particular facility related to shower and also related to access. But then what I have been talking about the care, the built environment issue is actually about home. And particularly related to the old 老旧小区, old and old communities or old building facilities. Often they have not access for people with disability, or go in or go out is very difficult. And in recent years, the government has done a lot of 老旧小区 renovation and trying to put lifts. But of course, this is still related to, it's not always the interest of the older people are looked after, partly related to the fact that older people may not necessarily, the people in need may not necessarily have a say in the building as well. It's not only related to the service providers and facility providers, but also the neighbor relations. So, so there's still a lot of ongoing, change in this field. Yeah.
Yes, Mr. Huang Yu have a question to Professor Fen Qiushi. It is that Nice to see you on this conference. Thank you for your presentation. As you mentioned in the talk, there are still quite substantial people in China, especially in the rural area, have difficulty in accessing to clean toilets. However, China has declared to eliminate the absolute poverty by the end of this year. It is difficult to conceive how people could be lifted out from poverty without accessing to basic toileting. What is your comment? So please, Mr. Feng.
Okay, thank you very much for the question. I think for the poverty erasement national project, it is supposed to be very successful by this year. And it's very promising. I think the Chinese government will be able to do it. But elderly care in terms of toileting difficulties are very different matter. Because the healthy the healthy elderly people, and when they got health declines, uh, what makes them their life a major challenge probably is not about bathing, because for some of them they could avoid bathing, uh, but toileting is a daily job. And when they have to use a seat to do the toilet, and they don't have the resources to do it, that will create a lot of trouble. In our field work, we do find some elderly people who handmade their own toilet by using the chair and to make a hole. And I think that immediately remind us of the necessity to incorporate the toilet, the population aging into the current toilet revolution in order to use the resource to help the needy older adults in China, which will significantly reduce the disabilities, as Professor Zhao Yaohui has already shown empirically. Thank you. Yeah. Yeah.
Yes, it's very difficult, I think, because of in west part of China, most of the absolutely poverty population live in the mountains. So if we need to resolve the toilet, the flushing toilet questions, maybe they need to resolve the water. So much more clean water is needed, and I think the infrastructure construction is very heavy to the government. So maybe slowly
Yeah.
resolve this
Thank you, Professor Zhang. May I just add one point? Because I think Singapore has a very good policy for Chinese to learn, to freely help the household to install a bar for the toilet pan, so that elderly people could use that bar to raise up after toileting. I think it's a wonderful idea for China to learn. Thank you. Yeah.
Yes, I think it's a solution. Yeah. And another question for Zhao Yaohui. Thank you for your really fascinating story. Since the rural toilet revolution began on the new socialist countryside campaign in 2006-2007, why did it take until 2018 for the benefits to show up to so strong from 2018? So please, Mr. Dao Yaohui. Oh,
This is this is a very good question, and this is also what we are aiming to answer, and hopefully in the near future. We're looking at the data. Government policies often take time to implement. So we're looking at the toileting, not just toileting, but also like shower facilities and internet and so on. See how they are implemented over time. Hopefully, by that we can also identify the effect of of these rural vitalization projects on people's abilities of daily living. Thank you.
Yes, I think we have a very important uh, uh, information about this because in the year 2014, President Xi Jinping talked about this kind of establishment, and they said that the Chinese government should push forward the toilet revolution. And after that, most of the Chinese government, especially to the local government, begin to resolve this kind of question. After 2014, 2015, some, I think the community toilet getting much more clean. You find this kind of evidence. So maybe after that time, all of the community toilet getting much more better for all of the foreigners and for the residents of the community. So it's very important information for us to understand that. And for Professor Feng Qiushi, since the rural population is aging and declining in China, what do you think the policy of rural revitalization should entail in order for it to succeed?
I'm not an expert to answer this perfectly, but I think we really need to change the economic structure of the rural area of China, attracting more young people to have their enterprises in the rural regions. Otherwise, the population aging will not give a good base for the rural vitalization. On the other hand, I do believe a lot of Chinese older adults, if there's a good infrastructure in the rural area, they might prefer to spend their later lives in the rural areas instead of the urban area. That's just my guess. Thank you.
Another question for Professor Li. As the demand of elderly care is tremendously increasing and the aging issue is focused on 45 years plan, next 5-year plan. The government funding community-based services will boom with no doubt. But do you find any chance of the market-driven or private community-based services in your study or in your research? So, Professor Li, would you like to answer the question?
Yeah, there are. Even during our field work in this kind of a pilot communities, you see most of them was sort of a social organized delivered services, but within these places there are still private provisions. I think and also there are several issues here. One is that the private service providers sometimes need space for providing the services. But in the urban communities, quite often space is a big issue. So it's not only the old age care sector cannot decide, and also they need joint decision making by several government departments, including the environment department, which have a one vote veto for taking extra space in a community. So that is a very important perspective for the community and the different government sectors to sit down together to look at what are the care needs in this community, and then what kind of private sectors would be suitable to come in, and if they want to come in, can they get this land to be able to deliver this service? So that is one important bottleneck. Another one is that sometimes there are competition between the public provided services and the private sector. One example is the community canteen. Many urban communities want to run this community canteen, but at the same time, in some other community, what you can see is There are a lot of small restaurants nearby. So in different cities, you see different policies. Sometimes they use the private sector giving voucher for older people to go out to eat. In some communities, they want to hold on to this money and to provide themselves. So there's, again, there are rooms for different sectors to compete. And yeah, so there are, I have to say, there are private sector initiatives, and also in the real estate sector, and they want to do a lot of community-based, old age friendly communities, including providing services. But so far, it's often the focus is on the real estate side. And to what extent is actually really suitable for old age people to live is still a question.
Yes, it's great because of in the community, the government encourage private sector to invest in this kind of constructions. So maybe in the near future, we can find more and more private basic services in community. And another question for Professor Zhao Yaohui. Many thanks for the excellent presentation. I have a question for you. It's great to know that the disability rate is declining in recent years in China. However, as shares is panel data, people survived all of the years may be healthy than those who passed away. Will this type of selection affect the result? Also, the age at which disability starts to appear may be interesting outcome variable to explore sex. So it's yes, it's a panel data, and the people already use this panel data to produce their paper. It's okay. I think it's a very good question for Prof Yaohui. So would you like to answer the question?
Yeah, this is a very good question and very good comment too. Um, at what age, when do people start to have an onset of disability? That is a very good question. And we actually looked at the panel change. They actually go in and out a lot. They become, they experience some difficulty and then they recover. And then people also then experience new difficulties. So there are lots of in and outs. And the mortality selection is a very good point. I don't think that drives the result. I think this is true. The decline is true. The mortality selection might contribute to some of it. I have to investigate, but I don't think that is all of the story. Yeah, especially the recent 2 years. It's not, I think it's a combination of factors. Toilet revolution and water, a tap water revolution occur at the same time. And also this poverty alleviation efforts in these 2 years and combined with the internet and things. So there are a lot of things happening in these recent 2 years. I think together they probably contributed to this big decline. But it has been declining gradually over time. That's also a fact. Thank you.
Maybe another question for all of the speakers. The question says that it is very interesting that you point out the need of introduce modern sanitation, especially flush toilet into the rural areas, as it is related to the health of the aging population in China, particularly in the rural areas. The custom has been to use the squat toilet or a hole in the ground. Do you know what happened in Japan, where the traditional preference is for squat toilet? Are they also introducing the pedestal toilet for the elderly who may otherwise develop an ADL problem. So it's a very important. Maybe in Japan they use this kind of the toilet, and in China maybe some of the ADL persons will like to use this kind of the method to resolve their problem. So maybe Professor Feng, would you like to answer this
Yes.
question?
Yeah, as far as I know about Japan, toilet, this kind of pedestrian toilet has not been introduced to address ADL issue because Japan has been already developed society. And then when WHO, promote this ADL as a universal standard to measure about elderly disability, the context is actually developed society. It's quite unfair to do such kind of comparison if toileting have different varieties. And that's why I think for sociologists, we really need to go deep to see how people do toilet. Because especially for the rural area, China have very different ways of doing it. Yeah. And that's why I think medicine has to meet with social science to together solve this issue for the benefit of older adults. Thank you. Yeah.
Another question for Professor Li. Thank you for this rich talk. I wonder if Professor Li could elaborate on the matter of labor shortages and the low pay of care worker. I understand that this kind of worker is dominated by female and migrant workers. Have there be any development in the matter of having enough people to actually provide care services for old people? Professor
Yeah,
Li?
I think you. Yeah, I think you are right, and saying that there is this issue of it's not only women but also rural to urban migrants, and what is in our fieldwork we find what is even more problematic these days is that a lot of the old age care workers they also have older parents at home, and so they are experiencing this double care issue, so that also prevent them from taking job for a very long time. This factor itself also make it difficult for them, even in the private care sector, to get higher salary. So so the kind of a pay issue are on both sides. Of course, government funded. There is also an issue of the reality is the affordability is a big issue, and also the labor supply, the turnover rate is very high, and also the older people, they the ability to pay for a large amount of, probably in Beijing and in Shanghai, these large cities, you can see older people want to go for the fancier kind of old age care home. And if you look at these old age care home, the labor turnover rate is lower, and the employees are also more loyal. But in the ordinary care homes, for supporting the lower income group is much lower. And also there is the not only old age care, but also the competition of labor between other types of care and old age care, competing for the labor cost. Relatively speaking, old age care gets paid. Employees get paid less. Thank you.
It's a common phenomenon because of the payment is much more low, and so the female workers and the migrant workers worked in this kind of sector. And in east part of China, in these 2 years, they reformed this kind of service provide system. And last month, I visited Ningbo, and the government official said that they want to end this kind of the payment and encourage most of the quite quality social workers to work in these sectors. Maybe some of the good good social worker, we do this kind of job in our east part of China cities. So it's I think. Another question for Professor Li. The question is that how is the assisted living apartment development in China? Could you address these questions?
Yeah, I haven't done very much research on this, but I actually visited some of them, some of the private sector businesses. I try to see what kind of apartments they try to develop. And I noticed that a lot of the big developers want to develop the properties for the rich people. And also when they talk about old age care facilities, and they try to sell it as idea for real estate, and then you also you can get it earlier, and it's a financing game. So you can get it now, but you don't have to live in it, and somebody else can live in it by the time you after you continue to pay for it for several years, and then you would be able to take over to live in it. So there are a lot of this kind of a financial game going on. So it's not very clear to me whether these are sustainable. And I know some of my friends even get this kind of housing, but they sort of regret it over time. So so of course I think there probably at this stage the real estate competition is a big issue, but probably over time, and when there should be probably more regulation as well, and to particularly protect the older people, and hopefully things will become better.
Yes, it's a very good discussion in our session, and for many questions and for many speakers. And I think the time is limited. So by the end of our session, we should say ourselves to organizer of National University of Singapore, and to all speakers and questions. And we have a very interesting interaction between us and discussion more about our interesting topic. So because of time, we have to say goodbye here. And everyone, goodbye, everyone. Goodbye.